Hey everybody, I'm the Wild Doc, and I want to elaborate on a story I just read about a 6-year-old girl who almost committed suicide. Thank God her mom saved her life. This was a psychosis or suicidal attempt caused by the widely prescribed flu medication, Tamiflu. Parents need to know the serious risks and the lack of effectiveness or any benefit this drug would offer to them or their children. Watch this video.
Their 6-year-old daughter took Tamiflu to ease the symptoms of the flu, but a North Texas family says that there were side effects that they could never have imagined.
Well, Doug, hospitals are filled with flu patients right now, many of them taking Tamiflu. But one young patient's reaction to that drug has her family saying, never again. Like so many others, it was a flu diagnosis that came with a choice, whether or not to take Tamiflu. But an Allen family who wants to remain anonymous says the side effects on their 6-year-old were stunning. Hallucinations, running away from school, and an attempt, they believe, to hurt herself.
The second-story window was opened, which was in her bedroom, and she was used her desk to climb up onto it, and then she was about to jump out the window when my wife came up and grabbed her.
So what these parents should have been told is the fact that the FDA had to issue warnings to Roche, the maker of Tamiflu, letting Roche know that they could no longer make any claims that their Tamiflu medication was capable of reducing severe illness such as pneumonia or preventing death.
It is written in the fine print, and Dr. Hardesty says there's always a chance of a side effect with any drug. The little girl's parents say they wish they had known.
I don't think the 16 hours of symptom relief from the flu is worth the possible side effects that we went through.
His message for parents, do your homework before taking Tamiflu.
Know that side effects are there for a reason. They're written down for a reason. I guess they can happen. And we got the short end of the stick.
So while the father's closing statements are of him saying that they must have received the short end of the stick, I'm here to tell you that there is no long end of the stick when it comes to Tamiflu. In fact, the Cochrane database of systematic reviews, which is considered the gold standard in medical review boards, their researchers looked at the data and evidence regarding Tamiflu and found out that Roche was hiding data. They were hiding information that, in fact, once they discovered that information and they acquired that information, they found out that Tamiflu maker Roche had hid the data that showed there were more severe outcomes, more vomiting, and in fact, more death. Several patients had actually died of kidney failure in the treatment group, and that there was no reduction in the illness or death rate of individuals from the flu. So the medication had no benefit at all. But before they acquired that data, the Cochrane database, in fact, called upon European nations to sue Roche until they released that data. In fact, the British Medical Journal here states that the Tamiflu, the battle for secret drug data. In fact, they had to battle the makers. The FDA didn't even have the original data from the research studies conducted by the maker Roche. No country had that data that showed the drug was ineffective and in fact harmful. And this case of this child attempting to commit suicide, again, thank God the mother was able to save the child's life before that little girl jumped out of the window. But that is not the same for every single child. In fact, there's been hundreds, if not thousands of cases just like this little girl that didn't end the same as this. In fact, they have here Newsweek reports on at least 70 cases, and this was back in 2014, at least 70 cases of people dying, many of them by suicide after Tamiflu-induced episodes. The deaths were almost surreal. A 14-year-old took their own life by jumping off a balcony, and a 17-year-old ran in front of a truck, committing suicide. Folks, when there is no evidence that this drug prevents severe illnesses like pneumonia that may result from the flu, and that this drug has no evidence, but the evidence actually points in the direction of an increased risk of someone dying, whether it be from suicide or kidney failure or complications due to the flu. There is no way that I would trade a half a day, and folks, that was it, a half a day reduction in the number of symptoms. That's why the FDA approved this drug in the United States. There is no way I would trade a half a day of symptoms in exchange for the potential for my child to ever commit suicide. I hope you'll make the same choice.